Hello, everyone. Welcome to Therapy Clips with Dr. O. Today, we will talk about the defense mechanisms. Defense mechanisms serve to protect us from anxiety and pain. I am from Human Service Consultants, and now we will move into our presentation. The first defense mechanism that I will inform you about is displacement. Displacement involves taking our frustration, feelings, and impulses out on other people or objects that are less threatening than who we are actually upset with. Now, I'll give you an example of what this looks like. Now, say that you are at work and your boss upset you. Well, you know that if you become too aggressive with the boss, you will be fired. So you say nothing. You keep it to yourself. But it's still very upsetting to you, whatever the situation may be. So you get off from work and you travel home and you're really trying to calm yourself down. But once you get home, someone in the household upsets you even further, not realizing that you are already upset because of something that happened at work. So whatever they say or do, you immediately take it out on them, when actually the frustration and the anger was with the boss. But instead, you may take it out on your significant other, your children, or your pets. This is what displacement looks like. And so, as a result of being angry or frustration occurs because of the situation, you may end up getting arrested or hurting the feelings of someone else to the point that they no longer want to be close to you. So your family and friends may leave as a result of your displacement onto them. This type of defense mechanism and all of the other ones are present in our interactions with other people on an unconscious level. The next defense mechanism is denial. Denial is the one that is most used, especially in treatment programs. When they tell you you are in denial about a particular situation. Well, denial does not necessarily have to be a bad thing, because what denial does is function to protect the ego from things that we cannot cope with at the time that is happening. So I'll give you an example of this. The example is you're at home, you're relaxed, the telephone rings, and it's your mother or another family member. And they tell you that one of the other families or friends that you know have just died. And you just spoke with this person not even 2 hours ago. And you're like, no, this is not happening. Well, that's denial too. Now, what's going on is the denial is protecting the psyche. And when we say psyche, then we are talking about the mind. It's keeping the mind from going, in layman's terms, crazy. So denial doesn't necessarily have to be a negative situation. Now, in treatment, they say you're in denial because they're actually, the clinician that is actually confronting the denial to move you past one point of your thinking into another point of thinking. So the clinician is actually moving you from one stage in the stages of change. And I'll talk to you more about the stages of change in another presentation. But we are actually moving you from one point to the next point in your thinking so that we can begin to do the work. So when a clinician, substance abuse counselor, or mental health therapist tell you you are in denial, we're trying to actually break the denial so that you can begin to work on your disorder. And so with people who have a substance use disorder, the denial serves to protect against pain. Now, I'll explain that just a bit further. No one starts out in their life with the goal to become someone with a substance use disorder. That is not what we think about. We think about, I want to be a nurse, I want to be a doctor, I want to be a teacher, I want to be a policeman. These are the types of thoughts that we have when we are growing and deciding on a career path. No one says, I want to be a substance user. I want to have a substance use disorder of any type. That is not how we start out. So the denial in substance abuse is this basically, I'm protecting myself from the pain of recognizing that I have moved to this level of substance use in my life. As far as someone with a mental health disorder, we tend as human beings to think of ourselves as perfect. Then you have some clinician coming along telling you, oh, you have bipolar disorder. You have major depressive disorder. You have generalized anxiety disorder. You have post-traumatic stress disorder. And you're like, what? What is all of this that you're talking about? So that is another form of how denial is used, is when we recognize that someone else is telling us that we have certain disease and disorder processes going on with us, and we are not ready to accept it. Now, I like to move on to two other defense mechanisms: repression and suppression. The first one, repression, means that we are actually unconsciously keeping information out of our conscious awareness. Now, what does this really mean? This means that some type of trauma have happened to the individual. For example, child molestation, rape, abuse. These are traumatic types of events that happen in the lives of some people. Now, unconsciously, because of the level of pain that's associated with the traumatic event, the person puts that information away in the files of their mind and cannot bring it up if they want to. So this means that in order to recognize and to identify with what's actually going on with the person, a therapist or a psychiatrist work with that individual to uncover those past traumatic events. This is what repression looks like. Now I am going to move to the next term. The next term or defense mechanism is suppression. Suppression. Now, suppression is that we are very conscious about an event, when that event happened and how it happened. This is still unwanted information that we want to keep out of our awareness. We want to bury that information. But if we need to think about it, or say, for example, we're watching a television program and the television program is similar to what happened to us in life, then it will trigger us to think about what we have buried. So when we know that we are putting this information away in our minds, it is called suppression. When we don't know that we are putting this information away in our mind, it is called repression. So, repression deals with unconsciously hiding painful memories, unwanted thoughts, or illogical beliefs that cause psychological distress. Now, I want you to note the difference in the two terms. Repression is unconsciously putting away those memories that we don't want to deal with unconsciously. But this is a different term. This is regression. Regression. Now, regression as a defense mechanism involves escaping to an earlier developmental stage in life. So, we are adult now. An earlier developmental stage before we became adult is adolescence, or we can just say our teenage years. Sometimes life can be so painful and so difficult, so traumatic, that we do not want to be adult anymore. We want to go back to an earlier time in our lives when things were a bit more perfect, when we didn't have problems and we did not have any negative situations happening in our lives. So this is what they mean by escaping to an earlier developmental stage in life. Now, when someone has a substance use disorder or a mental health disorder, they may have also had some type of traumatic event to occur in their lives because of lifestyle and being in situations with other people who have some type of psychological disorder going on with them or substance use disorder going on, and it leads to some type of trauma. A lot of females who are in treatment have been the victim of domestic violence or rape. And so, because of these issues, they may go on to develop a substance use disorder. But it doesn't just have to be with females. It can also be with males, because men get raped and men can also be the victim of domestic violence. Or, in another way of saying it, intimate partner violence. Now, we're going to move past this point to talk about another defense mechanism, sublimation. Sublimation. This is a defense mechanism that allows us to act out unacceptable impulses by converting these behaviors into a more acceptable form. So, I like to tell a story of Dr. Ben Carson, a famous neurosurgeon. He worked on the brain from Johns Hopkins Hospital. He has saved many lives, Dr. Ben Carson. Well, when he was a child or adolescent, I would say adolescent, not child, but when he was an adolescent, then he had a fascination with knives. So what did he do? He transformed his fascination with knives, which is an unacceptable impulse, to use a knife on someone else. But in his situation, he went on to still use a knife on people when he's doing brain surgery, but in an acceptable way. So, once again, sublimation is a defense mechanism that allows us to act out our unacceptable impulses by converting these behaviors into a more acceptable form. For example, a person experiencing extreme anger might take up kickboxing as a means of venting frustration. Projection. This defense mechanisms involves taking our own unacceptable qualities or feelings and ascribing. So what this means is we're putting these feelings and qualities onto other people. Now, an example is you may have a strong dislike for someone, but instead you will say, this person doesn't like you. Okay? Again, you may dislike the person, but instead you believe that this person doesn't like you. So the question is, how would you know? Did you ask the person? If you did not, understand that these are your feelings that you are projecting, that you are putting onto someone else. That person could very well like you. That person can very well care about what's going on with you. But in your thinking, because you don't like the person, you think they don't like you. This is how projection works. So, projection places the blame for an issue, such as a substance use disorder, onto someone else other than the self. Now, I want you to understand that projection can be positive or negative. In the case of someone with a substance use disorder, this is usually negative and unconscious to shift the blame from yourself onto someone else. So be very aware in your thinking and in your behaviors, and learn to take the responsibility for what you do. Because if you don't take the responsibility for what you do or what you have done, then you will stay stagnated in that way of thinking and not able to move forward. And as long as you stay stagnated in that situation, then treatment is not going to work for you. Now, true, it could be that you have been a victim of rape or domestic violence. Yes, some of us have been a victim of these situations, but it's not what have actually happened to us. It's how we make a decision on how to handle it. We are going to come through situations, and situations are going to happen to us that negatively impact us. But it's not the situation. Understand that. It's how you decide to handle the situation. Drug use, drinking alcohol is not the answer to solve a problem. What solve the issue and help you to move forward is a strong constitution and determination that you're going to move past the situation. You're going to put it behind you, and you're going to have the best quality of life that you can possibly have. That is what's going to move you from this traumatic situation happened to me. Yeah, it did. I'm not going to minimize that. But what's going to help you to move past the situation is to say to yourself, this has happened to me. I'm not going to let this person or situation take control of me. I'm going to move past this. I'm going to work on a daily basis to get over this and to throw that garbage in the trash. And I am going to have the best quality of life that I can possibly have. I hope this makes sense to you. The next defense mechanism is called intellectualization. Now, this is the one that works to reduce the anxiety by thinking about events in a cold, clinical type of way. Now, I'm going to say something to you. In treatment, mental health, substance use disorder treatment, we give you a lot of information through presentations, through fact sheets, through brochures, through handouts. And you are reading and learning this information. Now, when you're in treatment, when you're in groups, you regurgitate this information. In other words, you give the information back that was given to you. But there's something else that's going on here. And I want you to understand this. You can have as much information in your toolbox that you can put there to utilize in situations that you need to use it. But if you are not actually using it, and you're just regurgitating information that you have read and not putting this information into practice, you are involved in intellectualization. Okay? We can intellectualize all we want. But until we put some action behind it, until we work on our situation on a daily basis, the situation is not going to come under control. Okay? So this defense mechanism allows us to avoid thinking about stressful, emotional aspects of the situation and instead focus only on the intellectual component. Keep that in mind. We have to do the work. Now, this defense mechanism, rationalization, is, in layman's terms, making an excuse for your behavior. For example, I ate that chocolate cake knowing that I wasn't supposed to, but it's my birthday. I'm going out to party and drink at the bar. Why? Because it's New Year's Eve. Knowing that you're not supposed to drink because you have a substance use disorder. I am going to smoke this cigarette knowing that you have COPD or asthma or bronchitis. But you're going to smoke the cigarette anyway. Why? Because it calms me down. Knowing that marijuana still isn't good for you because it's also affecting your lungs. And if you do it long enough, you may end up with lung cancer, just like with cigarettes. But why am I going to do this? Oh, because I'm so stressed out today. So rationalization is a defense mechanism that involves explaining an unacceptable, I need to slow down. Explaining an unacceptable behavior or feeling in a rational or logical manner, avoiding